All right, wonderful, wonderful. Well, thank you all so much for joining us today. We are very, very excited to have some special guests with us on our webinar today. Before we get started, I want to tell you just a few minutes, just a little bit about Kentucky SPIN and what we are. We are Kentucky SPIN, which is the Kentucky Special Parent Involvement Network. We are the Parent Training and Information Center, we call it a PTI, for the state of Kentucky. We are funded by the U.S. Department of Education. And what we do is we provide training and information and support for children and youth with all types of disabilities, birth through age 26. Mainly what we do, though, is we like to say that what we do not do is we do not act as attorneys, but we empower families to effectively advocate for their children. We provide peer support and help families access needed information and resources. And I think that's what we're planning on doing today, is giving you all some much needed information and resources. But we like to say that what we do mostly is lend a listening ear. And I love this quote. This is from our director, Rhonda Logsdon. Who's on the call today, too. She says, the key to success for all our children during this unprecedented time is to work in a partnership as we all go down this uncharted territory together. So what Kentucky SPIN is trying to do is we are trying to provide as much information and use technology to the best of our ability to get information out during this pandemic that we're all in. So that's why we wanted to have our speakers today, and I'm so glad both of them can be on our call to answer questions specifically related to families with our Medicaid waivers. So our speakers today are Pam Smith, and Pam is the Division Department for Medicaid Services, the Division of Community Alternatives, and we also have Alicia Clark, who is also with the Department for Medicaid Service, Division of Community Alternatives. So we are very, very excited to have Pam and Alicia with us today. Can you all hear me, ladies?
I can.
I can.
Awesome. Thank you again so much for being with us today. We really felt like we appreciate all your all's webinars that you do to keep everyone up to date on what's going on with our Medicaid waivers during this time with COVID-19. But we really wanted to take a few minutes and get you all on with us so that we could answer specific questions that families may have. And so we're going to go through, I'm going to let you all go through these questions, and then I'm going to be watching questions in our chat box. So anyone online, if you have a question for Pam or Alicia that you want to have specifically answered, go ahead and type that under the questions. And also just to let you know, we do have handouts that you can download, or if you don't have time to download them, we will email them out to everyone following the webinar today. So don't take the time if you don't feel like you want to spend it doing that. You will receive them in an email following our webinar today. So if you have a question, you can put it in the question box and I'll be sure and answer, but I'm going to turn it now over to Alicia and Pam.
Thank you, Stella. First and foremost, I appreciate everything that you and your team are doing to get the correct information out to our families. So what we've been doing during this pandemic, we have been asked lots and lots of questions. We're actually, just to tell you all a little bit, we are meeting again right after this call to go through some additional questions to try to get we're getting questions from families, providers, other stakeholders, and we want to give you all as much information as possible. So we are putting frequently asked questions out there as they are being approved by management. And if you all are not on our listserv, we really, really would like for you all to submit a request to our Medicaid public comment at ky.gov. If you will submit that request, we can have Kelly put you in our listserv so that anything goes out to the public, we will get that out to you as well. We are posting everything on our website. It's if you Google the Division of Community Alternatives, Kentucky Medicaid, you will be put right there. So we want everybody to have as much information as possible. And to respect everybody's time, we'll get started with the questions Stella has put together for us and our answers. And then if you all have any questions, like she said, please type them in the message box and we will answer those as well. So the first one we have is, in the event that there are periods of time when people are asked to stay home, will the DSP or the PDS employees be permitted to provide in-home care to the 1915C waiver participants? So yes, if the service is being provided by the direct service provider or PDS employee, if it's emergent, meaning without that service, the participant would be placed in danger or the participant would lose functioning that can never be restored, the care may be provided. The DSP or the PDS employee should not provide the care if he or she has been exposed to someone who has tested positive for COVID-19 or who is displaying symptoms. Our governor, he's very serious about social distancing, and if you've been watching the newscast or his little Facebook page at night, you understand that the next, especially 2 to 3 weeks, are going to be very critical, and we need to ensure that we are using that social distancing to the max at this point. But if there is care that needs to be provided, it can be provided. Do you want to go to the next one, Stella? Unless somebody has a question specifically on this one. So can a PDS employee be permitted to work overtime to reduce gaps in service caused by the COVID-19 state of emergency? Yes, overtime is allowed during the COVID-19 state of emergency if necessary to address the health, safety, and welfare of the 1915C HCBS participant. The need for overtime should be first discussed with the case manager, support broker, service advisor, and that's depending on what waiver you're in as to what they're called, who is responsible to document the need and to update the emergency person-centered service plan. So please note that there's not been a change to the participant's overall health or community-based status, and there's no disruptions in the services as a result of this COVID-19 virus, then the increasing of the services should not be required. And then Medicaid will be conducting retrospective review of service increases to ensure that they were implemented for appropriate emergency-related reasons due to COVID-19.
Alicia, I have a question online. Let me get it where I can read it here. Can you clarify if PDS services can be provided via telehealth platforms if there is a natural support present in the home?
Pam, do you want to take the questions or do you want me
to? I can take that one. So okay. If the service, yes, so they can receive some telehealth services even if there's a natural support person in the home. You know, of course the telehealth services are limited in, you know, what can be provided based on, you know, a lot of our more clinical services, so behavior supports. Some of our ADHD and ADTs have found some innovative ways to do things via telehealth. That works well. When you start getting into some of the personal care type services, there's not as much that you can do, although there is some if you have an individual that just needs cues and reminders. Maybe that natural support is not really either because of their own health or for other reasons they're not able to follow through with that or do that, that we could see that telehealth could fill in those gaps.
Sorry about that. I was talking when I was muted. I do have another question. I'll go ahead and throw it in real quick before we go to the next slide. If a PDS employee has chosen not to work due to the current pandemic and Healthy at Home initiative, are they eligible for unemployment?
This is one that this is a question we've received a lot, and I will just be honest, this is not in our purview or actually in my scope of knowledge to answer, but we are trying to get the link to resources and to who can answer that question. So that is something that's coming in the FAQs, because we have received a lot of questions about that. I just don't want to give out incorrect information.
Wonderful. Thank you so much. So y'all can go on to the next question, and I'll interrupt as needed.
Thanks, Pam and Stella. Can the approval process for hiring immediate family members as a PDS employee be temporarily waived to deal with the service disruptions, such as the closure of ADHDs and ADTs and staffing shortages caused by the state of emergency? So yes, we are temporarily waiving the additional screening and approval process to hire the immediate family members as PDS employees. So if you're only doing it just for the state of emergency, we've got some specific instructions about how your case manager would put that information in the comments box of MWMA, which I'm sure that you'll probably don't know what it looks like, but each service has some information in there in a comments box. But if this employee, they must still initiate that background check and other screenings. However, while they are pending, services can be provided. Now, if the results of the background check or that screening make the employee ineligible for services, or it makes the employee ineligible to provide those services, the service will be allowed to continue until an alternate employee is found. However, I do want to note that the only exception in this case is where the employee, that background check would pose immediate jeopardy to the health, safety, and or welfare of the participant, or if they've had substantiated findings of past abuse, neglect, or exploitation, or a violent felony.
Now I'll add on to that we are working with Dale, and there will be a letter that's sent out that the support broker, case manager, service advisor, whatever term is used for that waiver, will be able to submit that fulfills that, because I think there's a limit in the system, but there'll be something that's provided that allows them to submit, to go ahead and submit that prior authorization. And in addition, those will be short-term prior authorizations. We will only approve those for 120 days at a time. If for some reason, and hopefully not, but if we're still within the state of emergency at the time that those are expiring, we will extend that temporary authorization. But once the state of emergency has resolved, those individuals in HCBS and SCL will be required to go through the formal screening process, but not until the state of emergency is resolved, and they will be able to continue working throughout the whole process.
Wonderful.
Thanks, Pam.
Okay, let me ask this question. It says, our therapy center said Medicaid is not allowed for speech therapy, occupational therapy through telehealth. Is this still not allowed? We do have the equipment at home to help implement whatever a therapist could guide us to do. We are now on week 2 with no therapies.
If you can, if that individual, Stella, if you can work with that individual to get us who that provider is, that is not true. We have expanded telehealth, and that's from waiver aspects across the board through our regular fee for services, and as well as our managed care organizations, to allow telehealth in any situation where it could be a possibility. And I'm not aware of any directive from Medicaid excluding those services. So if you can get me that information, we'll reach out to that provider to try to understand what their concerns are, or what their misunderstanding is.
I sure will, and that's why this call with you all is so very important.
Well, and on the flip side of that, I did have a complaint from a family that the therapy that they were getting or being provided was being required to be in the home. And so if you have any of those types of situations that you come across, please let us know that as well. You can work through Stella, or you can email us there at the department. But like I said earlier, the governor is very serious about social distancing. And so if there are things that can be provided through telehealth, that's what we are encouraging as well. So we will follow up on those type of cases if you have any of those.
Wonderful. Thanks so much.
So the next question is, can provider agencies or PDS employers use background checks on an employee that were completed by a different provider agency or PDS employer? Yes, during the state of an emergency, we are allowing those to transfer from one agency or PDS employer to another. So the next question is, how should the support broker service advisor add the new PDS employees during the state of an emergency? Sorry, I obviously got a little ahead of myself when I was talking earlier, but for new PDS employees that can be added during the state of emergencies, they will put that in the comments box in the MWMA and put in their comments, you know, due to the state of an emergency. And then when if they end it at any point in time, they can put a start date and the end date in those comments as well.
Alicia, back to that other question about the background checks being able to be transferred. Is that when the state of emergency is over, will they have to go through new background checks?
We're actually looking, we're gonna look into that. That's one of the things that I have down and that we are adding for discussion. One thing that we believe that is a positive coming out of this state of emergency is that we're looking at how we do business differently. And it really fits into kind of the overall waiver redesign, you know, that our goals with that. So I don't have a answer right now for that, Stella, but we're working on that. And it, you know, just to be honest, it seems silly that we would make someone go through that background check. But I'm just checking off all the boxes with CMS and making sure that, you know, that we do exactly what they expect us to. But I think that's one of the things that we're going to be looking at post state of emergency to see how we can do that even for the future.
Awesome.
Will there be a grace period on the annual requirements for maintaining PDS employee eligibility? So the answer to this question is yes. DMS will temporarily allow services to be initiated before confirmation of certain eligibility requirements, such as the tuberculosis risk assessments and screenings, CPR, first aid, and other trainings, and providing a copy of the driver's licenses. The case manager, support broker, or service advisor is responsible to ensure it is documented that these core requirements have not been met and the reasoning which is due to the state of an emergency. These requirements will be reinstated at the end of the emergency, so if possible, employees should continue to work to confirm any pre-employment requirements. We do understand right now that, you know, people aren't, you know, a lot of people are coming up for their CPR recertification or their TB skin test. And we understand that you cannot get out into the community where you need to receive these trainings or the assessments or other screenings. So we, you know, there will be a period of time in which even after the state of emergency is over, we understand that you can't get it done within a week, because sometimes like with CPR, you have to, you know, go and register and it might be a little bit out, but we definitely are waiving those and allowing those to temporarily, you know, that you might be out of compliance, but we just want to ensure that everybody documents their reasoning to being out of compliance during this time. Can a PDS employee who is unable to work due to the COVID-19 state of an emergency file for unemployment? So I think somebody kind of asked this on the call earlier, but PDS employees may file for unemployment if they meet those eligibility requirements. And this can be done through the Kentucky Career Center, which we've got the website up here. Again, like Pam said, this is really out of our purview to answer whether they can get unemployment. So we would not even want to try to provide you an answer. We really want to give you where to go so that you can, you know, reach out to the appropriate folks to see if you're eligible or not. And then PDS employees can also reach out to their support broker or service advisor for any additional information on whether they have paid into unemployment.
Alicia, what about the families who currently maybe are not, in the system to provide the direct care for their child or their young adult, but now that, they are at home, want to do that? Is that an option now for anyone?
So can you kind of give me a little more context about that? Are these people who already have waivers? Are they?
Yes. It's a family member who, was not currently an employee, was not working to provide services for their child. They did have outside, direct support professionals that was doing that. But now, since, they're home and they can't, the other folks that were working can't anymore, are you all doing anything to get them emergency where they're able to provide those services now?
And so they would just need to, sorry, Alicia.
No, go ahead.
They would just need to talk to their support broker, service advisor, or, the case manager, and just do a modification to add them. They, would need to, of course, note that it's during, COVID-19, and use that, the case manager will have that form that they can upload that says that, we're waiving the, for those that are required right now to go through that screening process. If they're immediate family member, they'll attach that document that we're sending out to them. But yes, they certainly can. And we're encouraging to go along with the governor when that can happen versus having individuals from the outside come into the home. That's the best scenario. Since, when you think about it, if someone comes into the home, they're bringing, anybody that they've had contact with, those germs, or that, exposing everybody in the house to that. And then every time they go from that individual's house to the next person's house, then it just spreads. And you can kind of see that. It is a good illustration of why social distancing and why we're trying as much as possible to limit the number of individuals that are coming in and out of homes, while still we want to provide and make sure that our individuals are safe and that their health care needs are still met.
And that's why I brought it up, because I know that, that is a concern with families that, they don't want to lose their services, of course, for their child or their young adult, but yet, maybe they're not set up to do anything. So yet, they want to, but just not sure really how. So that's great that there can be an emergency, emergency paperwork completed so that they could fulfill those needs during this time and then go back to the way things were after all this is over.
Absolutely.
And it will be
over yes, it will be. And we're going to get through it together.
That's right.
But just to let you know that also, if you are suspending services because you feel that that is what is best for you and your family at this point, we are asking agencies, because usually after 60 days without going with any, direct services, because you can't just have case management only, the normal process is for you to be disenrolled from the waiver. We are asking all provider agencies, do not disenroll people from their agency, whether it be, direct service, direct services or case management services because of COVID-19. We understand that we have a lot of medically frail individuals, and we need to do what is best to keep them healthy during this time, and do not discharge anybody during this time.
Wonderful. Thank you so much for clarifying that.
So the next question is, if a newly hired agency employee has not worked in the field, can they complete required trainings while working? Yes, this is allowed during the COVID-19 state of an emergency. The only trainings DMS is requiring to be completed during the state of an emergency are the ones related to health, safety, and welfare of the waiver participants, such as medication administration. Obviously, we don't want people giving medications if they've not been trained to do that. And we think it's very important, and it could be, several different people that could do some training, but those specific trainings related to the needs of that specific individual, because we know everybody's case is different. So if there is something, very special, we want the individual to be trained on who they are giving those services to. And then it looks like we are ready for any additional questions that you may have. Like I said earlier, we are giving, every time we get things approved, there are several rounds where we go through, we discuss it, we update it, we, talk with our sister agencies. And then once everything's approved, we are pushing those out literally as fast as we can. And we're putting those out there on the Division of Community Alternatives website, along with sending it out to our listserv. So if you are wanting to be on our listserv, if you can submit that request to the Medicaid public comment mailbox that we have, that would be great, so that we can make sure that you get the information.
And Alicia and Pam, when I send out the follow-up emails to everyone, I'll be sure to include that in there also, along with the frequently asked question document and other resources that we have put on here for handouts today from you all. The only other question is really not a question, it's more of a comment. It says, and I will send you to specifics on who is mentioning these, if they're okay with that. It says, I also spoke to my nephew's therapy clinic and told they have been denied to use telehealth. So it sounds like to me that might be just a communication issue that you spoke about earlier, about reaching out to those agencies and letting them know that telehealth can be used.
And just one request, if they can provide, the agency, and especially if we have like the ages of the individuals, that might help us pinpoint, whether it's a state plan service or whether it's being provided through the waivers. So just because we want to make sure that even if we're getting that out there, we will ensure, Pam will send this to our state plan side, but just so we can kind of pinpoint whether it's state plan services or the waiver services.
I'll reach out to those folks individually, and is it okay for me to give them your contact info and have them reach out to you?
Absolutely.
Okay, perfect.
And I would encourage Stella, I'll put that out there, that anybody that, if anybody has any questions, after this, that they think of after it, to reach out to us. And, one of our focuses is trying to make sure all the correct information is shared. And also we want to help resolve issues like what is happening with these therapies. So please, share with your individuals our information, and encourage them, if they have questions, to reach out to us so that we can help get the right information and the right answers. We may not have them, but we can connect them to the right places.
Absolutely, that's what I will do for sure. And you all are more than welcome to stay on the call with us. Rhonda is going to take over now and do some education updates, and then we'll see if there's any more questions at the end. So Rhonda, I'm going to turn it to you.
Thank you all so much, and we are so appreciative that you all joined us today to help, because it's such needed information as a family myself, and other families throughout the state, especially during this time. And you know, we are very dependent on waiver services and the supports that are given. So thank you again so much for joining us. And what I'm getting ready to do is I included some other important COVID-19 updates, but specifically education we'll go over right now. One of the things, and if y'all were able to join us last week when we spoke about educating children with disabilities during the COVID-19, of the handouts that has been provided through OSER, other guidance since then, was released specifically addressing initial questions, Q&As, in regard to vocational rehabilitation services. Because this guidance, and it is included as your handouts and will be emailed, but or the link you'll be able to click on the PowerPoint directly to it, is initially this is just addressing sort of questions about how states are going to be able to be accountable providing the services when they've not been able to due to the COVID-19. But, and the reason I wanted to include this in here is, if you'll look at the bottom there, that it is stating that in the future, there is going to be more questions and answers that'll be released from the Office of Special Education and Rehabilitation Services that is directly related to the service program and really will help give us some more guidance in that area. The next update that we have is I thought it was very important that we concentrate on this, and this was Kevin Brown, the interim education commissioner of the Kentucky Department of Education, issued a letter to families, and you can link directly to that. And this meant a lot to me when I read this, because KDE's focus is not just education, it's to educate, feed, and support. We all know, and now that in a follow-up to our webinar last week, and we had indicated in there that the Kentucky Board of Education had went ahead and improved all 172 of our public school districts to provide the non-traditional instruction program. And this is getting everybody on that. Now, to understand, and what's critical here is we've got districts who have never before been on the NTI program. So there's a learning curve, and especially depending upon how large the district is how many students that they are providing that. So again, I think through all of this, whether if it has to do with education, waivers, if we all have patience with one another to sort of help get through this, because we are all, you know, there's no playbook for none of this. None of us have ever experienced this in our life. So the important part that now that there is in place for all public school districts that they are on the NTI program, so that there is education when the school is closed and not able to meet, our children are all still getting an education, and through an alternate means, which is the non-traditional instruction program. The second here, which is so important, is to feed. And because so many of our schools have such a high number of free and reduced lunch, that school districts, and there's a link on our COVID-19 page of a spreadsheet that was created by KDE that goes down by county and gives you the locations where families within each county can access and get breakfast and lunch Monday through Friday when the schools are closed. But it's so critical because many of our students, you know, if that wasn't in place, then our children may not all have food. And then lastly, in that letter to families, it was to support. So one of the things here is how we all work closely together, how the Kentucky Department of Education supports not only the schools, but students and in our families as we go through this. I just think it's very important to address that, and it spoke volumes to me that those are the things that are being addressed and what is the assistance that is being provided in the state of Kentucky, which again makes me so proud to be a part of Kentucky, because we are looking at this not just educate, we're going to feed and support. We're all in this together. So the next slide we'll see here is another thing too is that Senate Bill 177, and the reason I put on here, we've got so much information being shared through a variety of means. It may be a tweet that goes out, or a document that was created as guidance. The governor signed the Senate Bill 177, which is going to allow as many non-traditional instruction days to be approved as needs to be for COVID-19. So they don't have to keep going back and getting the approval. There's been in the Kentucky Department of Education, Kevin Brown, the interim education commissioner, also tweeted and said, so now that there is a blanket approval, so he has the authority, and this was the, you'll see the picture down there of the email that he had sent out, was that he is able to go ahead and grant those additional non-traditional instruction days as seems necessary due to the state of emergency we are in and the COVID-19. So that is going to be very helpful, so that everyone doesn't keep having to go back, that there has already been that flexibility built in, because we all know everything is changing daily. We've got to be able to adapt, and it may be that we're on this longer. The last that I saw posted and recommended from the governor was all schools to at least stay out to the 20th, April the 20th. Now, again, that may be changing again here soon, and it had changed from what previously had been said, because we're all learning different things hourly, daily. And this not having the children in school is how we are going to be able to keep them safe and help everybody to slow the spread of the COVID-19. Now, on the next slide, you'll see we have one of the things, too, that was important, because the U.S. Department of Education announced that it was going to let states be able to apply to be pretty much waived, or that they don't have to do the standardized testing. Kentucky applied for that, and it already heard back that the commissioners already heard back that they believe that the waiver request will be approved, and the accountability and reporting requirements will be granted, because the children are not in school for in person. So they are not going to have to do, if everything goes through as planned, they are not going to have to participate in the standardized testing this year. So now the other thing is that this is, and we'll keep this post updated as we go through here. But I think this is important, because right now our children need to concentrate on the non-traditional instruction and getting that instruction so that they're able to be successful. So we'll go ahead to the next slide. Now, one of the things I thought was very helpful, and I did not realize this, and you don't typically hear this a lot when you've heard of the stimulus package, but the Southern Regional Educational Board, which Kentucky is a part of, through that stimulus package, there is also funds, and this is an expert, from that document, and you can click on the funds for K-12 and post-secondary education directly to that document they created. There is extra funds that are going to help with different activities that are going to help support and relieve a lot of our schools and offer a lot of that assistance. And you'll see where I highlighted IDEA. So they have the, any activity authorized by IDEA, which is the Individuals with Disabilities Education Act, which is what calls for IEPs in school. That will be one of the things that, if there's activities under that, then that can actually be used through those funds. And there's a whole list of those specialized. And I was very pleased to see this, because I don't know about you all, but I hadn't heard anything about part of the stimulus package actually including anything for children in school. And also, too, the long-term closures, including providing meals for students, technology for online learning. So there's been some flexibility which I think is so important, that's going to be able to help, because every area is different, and how you're going to be able to reach the need. Every family is different, and educators. So there's going to be that flexibility and funds that may be able to help in this time of pandemic. So we'll go ahead to the next one. Another thing, though, too, is I wanted to point this out. This was a slide from our webinar last week. And the reason I wanted to bring this back up in this week's is because over the weekend, I saw some misinformation floating around. So I wanted to take this opportunity to clarify, because this is directly out of guidance from the U.S. Department of Education, that when we're talking about the IE teams, that they're not required to meet in person while schools are closed. Now, this is the part where I saw some misinformation, because it stated, when it says here, if an evaluation of a student with a disability requires face-to-face assessment or observation, the evaluation would need to be delayed until the school reopens. I saw information floating around that evaluation timelines and all of that information remain the same. Here's the thing: even if there is a certain amount of time that is required for the evaluation, but due to the COVID-19 pandemic, you are not able to meet, because if it's an assessment, an evaluation that it has to require face-to-face assessment or observation, which you all are in the same room together, that can during this time. So, I want to make sure that everybody is under the same impression here from the guidance we've all been issued, is that those type of things, if it is an evaluation, reevaluation parts that doesn't require the face-to-face, yes, you would look at alternate means as long as the parent or legal guardian consents to do it. They also state that the same principles apply when we're looking at activities conducted by appropriate school personnel for a student with a disability who has a plan under 504 and is being evaluated for 504. So just keep in mind that during this pandemic, when the children cannot be in school in person, and we are on the non-traditional instruction days, if the evaluation requires face-to-face or in-person observation, then it may not be able to occur during that time. So I just wanted to take that moment to further clarify that, just so that everybody knows, and a lot of it is we're all sort of learning and going as we get guidance. But I did want to make sure that I mentioned that we already have the recording available from last week's, and when you get this PowerPoint or in the handouts, the link up there to the recording, you can access that immediately, and also the actual full fact sheet from there. Another great thing I wanted to concentrate on, the Kentucky Special Education Cooperatives developed in our friends at Kentucky Autism Training Center shared this last night, and I'm so thankful. The online professional development opportunities booklet, and this is a link directly to it, and it was developed by the Kentucky Special Education Cooperatives. Our special ed co-ops are so important in our state, and here are the different topics that it will link you to for that, and we will make sure that you have that in the link for that, because every school district in Kentucky is served by a special education co-op, and you will see the pictures there of all of them in Kentucky. They are divided up into regions, and our special education co-ops, they offer guidance and assistance and training to educators specific when it deals with special education. And they are so crucial and such great partners of ours throughout the state. And that was a wonderful document and online opportunities where you can learn more. So I want to make sure that I shared that, because our special ed co-ops, they are doing wonders. They always have, but especially now going above and beyond, really helping districts with the non-traditional instruction right now in regards to special education, because many of our districts haven't received that. So So what I wanted to make sure is just so that you knew that they were there and could help you in this document, and there may be some learning opportunities that you want to take advantage of. Another thing too was KET launch starting this week, and those are directly to it. They redid their host scheduling program to really help while the children are at home, really targeting their weekday program to help our families and our children in ways to learn. And that is a great resource. Because our families have access, not everybody has internet access, and there are some websites or different things that you can access, but if you could actually tune in to the broadcast and the programming, it could really help with those things. I know as a parent myself, there's a lot of it, and I explained last week too, there's a lot that I didn't learn that way, and I need to be able to help my child best. And it will be a great tool, not just for kids and parents, but professionals alike. So we're going to have some other updates coming up here in just a minute. Another one that was very important, and I was so pleased last week, was the governor issued an executive order that suspended all evictions due to COVID-19. And I think this is so crucial given the times that we are having right now. Many have lost their jobs. And the last thing that a family needs to fear is losing their home, losing, losing the place that they're supposed to be stay safe. So I thought that was very important. I want to make sure everyone was aware of that. Another thing too, and you may be tired of hearing it, but the social isolation is what is occurring is and I'll be honest too, there's some things that I didn't really think through, because you get into such a habit that you want to just carry on as you normally do every day, but we can't do that right now. So there is a lot of things in urging, we have a lot of stores closed, but what is happening is what is open is getting so crowded. So we all have to play a part in this, the social isolating, so that we don't want other places to close down. So we need to all take, if we have to go to the store, it should just be one of us. It shouldn't be the whole family going, or it shouldn't be a couple. I know what we're doing is, and my mom and my brother are at very high risk category for this. When I go, pretty much the only time my mom's going out right now is for doctor's appointments that she has to. When I go out, I go and it's just me going to the store. Not like we normally, it might be several of us. You can't do that anymore. And if you go to the store and there's a lot of people, don't go in. And I know that it may sound silly, but really what's going to make a difference is if we all start doing this. And he also announced to restrict travel. This is very key, not to travel outside of the state unless, of course, for work. But other states are not doing like we're doing. So if you go to another state and to their different stores that maybe you can in Kentucky because they're closed right now, you're defeating the purpose. You are putting yourself at risk and your family and others that you are bringing it back to Kentucky to. So if we all just keep that in mind, I know, I've been guilty of, I went in a couple of places I probably shouldn't. I could have by just going in one place, even if it wasn't crowded, and I had to remind myself, okay, you really shouldn't have done that, Rhonda. So, none of us are above anyone else. I've made mistakes, but what's going to help, and also too, a lot of times people are thinking that this doesn't apply with having people over to your house. It does. The only people that should be to your house are ones who are the family that lives within the house. You don't invite a bunch of people over, because we're hearing different things. There may be some adults with disabilities, or some families that are carrying on as usual and having big groups of people over, that can't happen. It's defeating it, and it's going to cause the spread to be even worse. Because I don't know about you, but I don't want us to end up in the situation that other countries have had to be in because of lack of medical resources. I don't want people to start to have to choose who lives and who dies. So if we always just remind ourselves of that and keep that in mind, I know that you can go stir crazy, but let's just keep that in mind so that we are making a difference, and it is important, which I'll quit preaching, but we'll go on to the next slide, but it is important for us to all do it. Also, too, there was tweeted again about Medicaid, because there may have been some misinformation or miscontact information that was shared. So I wanted to make sure directly from the governor's tweet that if it's just Medicaid only, you call this number. If it's SNAP and Medicaid, you call this number. He also shared that picture that explained more. So just keep that in mind, and I want to make sure that everybody has the accurate information of who they get to get the answers as well. So the next slide we have, and I know we're getting close to our time here, but I wanted to make sure there's a couple things. So I wanted to include this too, because there are a lot of, and this isn't the whole picture. It links to the complete picture because I couldn't find it in a PDF document, but there is a picture of frequently asked questions that Congressman Don Yarmouth, which I was so thrilled about, that he put out, because in the part that I kind of zoomed in here, because it's typically asked questions that I'm finding everybody's wondering about the rebates that is in the stimulus package. So I want to make sure the payment of the $1,200 for each adult or individual, $2,400 for joint filers, or $500 per child under the age of 17. Advance payment of the rebates is reduced by 5 for every 100 of the income to the extent the taxpayer's income exceeds $150,000 for joint filers, $112,500 for head of household filers, and $75,000 for anyone else, including single filers. I liked that information. It was much clearer than what I saw shared numerous times, because it was never as detailed as that. Because if you're like me, what you saw shared all the time is the $1,200 for people who make up to $75,000, right? But that gives more detail of the exact criteria. Another important part down here at the bottom that I wanted to make sure of is that if you're on the Social Security, and you don't have earned income, is not a requirement to be eligible for the rebate. And you may not have filed your taxes, you weren't required to on Social Security, you can still receive the rebate. What they're going to do is they will go by the Social Security Administration to issue those, and they'll have a campaign to reach others who may be non-filers of the income tax, because you may not have been required to do that, and provide information on how you can access the rebates. So I wanted to make sure everybody knew that who that from the initial guidance that we're getting is who that applies to, and those are some typical questions that I saw from others. So we'll go ahead to the last well, close to the last slide, but I wanted to also make sure Kentucky Voices for Health has a couple of very helpful handouts, and those are part of your handouts within this webinar. One of the things that I kind of pulled from that, if you're already enrolled in Medicaid, SNAP, KTAP, or CCAP, your benefits have been automatically extended by 3 months. That's huge. The other handout, and there's some other helpful information where it breaks down in that handout, Medicaid, SNAP, KTAP, and CCAP. Also, too, what Kentuckians need to know about the COVID-19. And I wanted to make sure, and this, you know, I know we've all heard and researched and we saw tons of things. The thing that sticks out to me here, I think, is one of the most important things for us all to realize, and it plays a part in us staying away from others, is many people with the virus will have no symptoms, but may be contagious for up to 2 weeks before feeling sick. You can feel perfectly fine, have no clue that you have really been exposed to it. And that then, to me, is where it's very dangerous, because Normally we know if we're feeling bad, you don't go around others. But, all of us can carry it. Even though there's high risk categories, all of us can get it and it can affect us equally. So I just want us to keep those things in mind. And those handouts are very helpful. I'm all about the helpful handouts that different organizations have, because just like the frequently asked questions that the Department for Medicaid related to the waivers did, I think these, where they're answering these specific important questions, are very helpful for all of us. We'll go to the next slide. Thank you. This here, and I know we have shared this on our Facebook and our Twitter. This is so important, because yes, we want to stay physically healthy, but due to the COVID-19, we all have very stressful lives to begin with, but even more so now. And one of the things that my coworker Kelly and Stella, it's like, it's okay not to be okay. And I'm like, it is okay not to be okay, because I think we've got to have it all held together, but know that there is someone you can talk to, and if you don't feel like talking over the phone, if you're a texter, there are those things, because the mental health, the strain, the stress, the anxiety that just dealing with a pandemic does is, I did not realize, I had figured, when you've looked and heard of things that have happened in history, I figured that it would affect you greatly. I did not anticipate what it actually was to live through it. I guess, we all know, as we live through things, we know better. But please take those times. Mental health is just as important as your physical health. And so I just want to make sure everyone's aware of that is available 24/7 for anyone who needs it. So I know there's been a lot of things included. You're going to be, does anyone have any questions right now? Or if you do, we're going to be having the great thing that I already know, because we're doing the weekly. We have it scheduled all the way through April, and we'll extend and add other dates as needed to keep doing our weekly COVID-19 updates. We're very pleased to announce next week, next Tuesday, 11 to 12, our guest that's going to be on with us is KPFC, Kentucky Partnership for Families and Children. And they're going to share with us some tips and things to do, especially when you're talking about social, emotional, and the mental health resources, and really from a family or youth perspective. So that is so key and so important. So I just want to let you all know, if you haven't already registered, and help us spread the word, they'll be on there, and any additional updates that we'll receive, I'll also include in that, if there's some education updates, just like I did today, other resources that are helpful for families. I don't think I see any questions right now, but if I've missed it, you can always send us an email and ask. Thank you all so much for being on with us today. Please stay safe, and we are very grateful for you. And take a moment to fill out the evaluation if you can. It'll be prompted as soon as this closes, the webinar. Stay safe, and please take some moments to enjoy everyone around you, and some time really just to take a deep breath from this craziness that's going on. But thank you all so much, and I hope you all have a great day.